All right, welcome back everyone to the deep dive. Today we're diving into something a bit different but really, really important. We're talking about the mental health challenges, the real struggles faced by undocumented immigrants right here in the U.S.
It's a really heavy topic,
Mhm.
a lot of complexity. And when you start to think about the individuals and the families involved, it's just the weight of it all.
Yeah, no doubt. And that's why we wanted to take a deep dive into this research. Really unpack, what these challenges are and what makes it so hard for folks to get the mental health support that they need.
Right, because what we're seeing in these sources is pretty alarming. We're learning that undocumented immigrants, they're actually at higher risk for all sorts of mental health issues,
Mm.
anxiety, depression, just this constant heavy stress, way more than people with legal status.
It's almost like, this constant fear of being separated from your family. That's got to be a huge weight on your shoulders,
Yeah.
right? It's like
Yeah.
chronic stress. It
Yeah.
just wears you down.
Yeah.
And that's something that's so unique to this population.
Totally. I mean, just imagine living every day, not knowing what's going to happen, always looking over your shoulder. It's got to be incredibly difficult to cope with that.
But here's the thing. Here's what really struck me. Even though they are more likely to need help, to need support, undocumented immigrants are actually less likely to, actually use mental health services.
It's a huge gap, isn't it, between the need and actually accessing those services?
Exactly. And so that's what we're going to try to figure out today. Why is there this disparity?
Well, there are a lot of factors at play here. Our research points to a few key areas. Let's start with the most basic one: access to healthcare. Many undocumented immigrants simply don't have health insurance.
That's right. I mean, think about it. If you don't have insurance, getting any kind of health care, let alone mental health care, can be way too expensive.
And then you add in the fear of deportation. That's a huge barrier and a really unique one. Just going to a doctor's appointment could lead to, being separated from your loved ones.
It's like every interaction, every time you have to show your ID, it's a risk. It's got to be terrifying. And it's not just the fear. There's also this lack of understanding of how the U.S. healthcare system even works.
That's a great point. It's already confusing for people who grew up here, so imagine trying to navigate it if you're new to the country, especially if you're worried about getting in trouble with the law.
Exactly.
Yeah.
And we also have to talk about the stigma, right? I mean, in a lot of cultures, it's just not okay to talk about mental health issues. It can be seen as weakness or something to be ashamed of.
Yeah, and that stigma can be really hard to overcome. It prevents people from seeking help, even when they really need it. And then there's the language barrier.
Oh, absolutely. If you can't communicate with your therapist or doctor or whoever, how can you build that trust?
Hmm.
How can you really open up and get the help you need?
That's where culturally competent care comes in. And this is about so much more than just having a translator, although that's obviously really important. It's about understanding, deeply understanding, the cultural norms and beliefs around mental health.
Right. So, like, what might be considered a totally normal reaction to trauma in one culture could be seen as a serious problem in another.
Right, exactly. And a culturally competent therapist would be able to recognize that and provide support in a way that makes sense for that individual's background.
It's about meeting people where they're at, isn't it?
Mm-hmm.
And our sources, they really highlighted some important insights from people who are working on the ground with these communities, clergy, church leaders, activists, mental health professionals.
One of the biggest takeaways was the need for safe spaces. Places where undocumented immigrants can feel like they can be vulnerable without being judged or, reported.
That makes a lot of sense. Trust is so crucial. And speaking of that, our sources also brought up some ethical considerations, specifically from the NSW Code of Ethics.
Yeah, it's all about respecting the dignity and worth of every person, regardless of their immigration status.
Right. So social workers or anyone working with this population, they have to be really sensitive to the discrimination that these folks are facing. It's a huge ethical responsibility.
Absolutely. Now let's talk about the impact of legal status itself on mental health. It goes way beyond just the fear of deportation. It affects pretty much every aspect of your life.
Yeah, you can't work legally. It's hard to get an education. You might not qualify for any kind of public assistance. That's going to be incredibly stressful.
And the research actually backs this up. In states with really strict immigration enforcement, undocumented immigrants have significantly worse mental health outcomes. It's a direct link between policy and well-being.
It's a really powerful reminder that these aren't just like abstract issues. They have real consequences for real people. So what about the challenges that service providers face when trying to help this population?
Well, one of the biggest ones is just the lack of resources. There aren't enough interpreters, especially those who are culturally sensitive, and there's a real shortage of materials and resources that are relevant to these communities.
It's hard enough to talk about mental health issues,
Yeah.
but if you're trying to do it through a translator who might not fully understand the nuances or who isn't familiar with your culture, it just adds another layer of difficulty.
And then there's the anxiety that a lot of undocumented immigrants feel about being misunderstood or even mistreated by healthcare providers.
Yeah, I can imagine that. Like, will they take me seriously? Will they tell someone about my status? These are real fears.
And we also have to think about the risk of re-traumatization. Many undocumented immigrants have already experienced trauma, either in their home countries or during their journey to the U.S. Seeking help could bring up those painful memories.
And if the provider isn't culturally sensitive, it could actually make things worse.
Right.
Right.
Exactly. And then there's the fear of losing your job if your employer finds out that you're seeking mental health help. It's just layer upon layer of stress and worry.
And it all comes back to this lack of cultural competence in the system, doesn't it?
Yeah.
There's just not enough understanding of the unique experiences and challenges that undocumented immigrants face.
We've talked about this a bit, but let's dig a little deeper into why mental health services are so underutilized by this population. I mean, we mentioned stigma, but how does culture play into that?
Well, different cultures have different ways of dealing with emotions and seeking help. In some cultures, it's more common to rely on family and friends for support rather than going to a therapist.
That makes sense. So seeing a professional could be seen as a last resort, or even as a sign of shame.
Right. And we talked about language and cultural barriers, but can you give an example of how those can lead to a lack of trust?
Sure. Let's say a therapist doesn't speak the patient's language fluently, or they make a cultural faux pas. Something that might seem small to them could be really offensive to the patient.
Yeah, like making eye contact or asking really personal questions right off the bat. That can really damage the relationship and make the patient less likely to open up.
And we can't forget about poverty. If you're struggling to put food on the table and keep a roof over your head, mental health care can seem like a luxury.
It's hard to prioritize your mental well-being when you're just trying to survive,
Yeah.
right? And then there's the constant fear of getting in trouble with the law. That fear is so powerful for many undocumented immigrants that it outweighs any potential benefits of seeking help.
And it makes the entire system feel unsafe. It's really a key point from our research. This underrepresentation in mental health research makes it really hard to know what works best.
Exactly. If we don't study this population, we don't know how to best support them. We're making decisions based on incomplete information. So how do we start to address all of these challenges? Our sources talk about some useful frameworks, like empowerment theory. What is that exactly?
So, empowerment theory is all about helping people find their own voice, building on their strengths, and supporting them as they take control of their lives. It's about giving them the tools to advocate for themselves and their communities.
So how does that actually work in practice?
Well, for an individual, it could mean teaching them how to navigate the healthcare system or how to stand up for their rights. For a group, it might involve creating support groups where people can share their experiences and learn from each other.
And on a community level, it could mean supporting grassroots organizations that are working to improve the lives of undocumented immigrants. It's about creating a sense of agency.
Exactly. It's not just about giving people handouts, it's about empowering them to make change. And then there's social exchange theory, which is basically about this cost-benefit analysis that we all do, right?
Yeah, we weigh the risks and rewards of our actions. So for an undocumented immigrant, the risk of getting deported might outweigh the benefits of getting mental health care.
Right, so we need to make sure that the perceived benefits of seeking help are greater than the perceived risks.
And that comes down to building trust. If people feel safe and respected, they're more likely to reach out for help. And finally, there's the socio-ecological model, which takes a much broader view.
Yeah, this one looks at all the different factors that influence a person's well-being, from their individual experiences to their family and community to the larger systems and policies that affect them.
So, like, an individual might be dealing with trauma, but that trauma is compounded by poverty, discrimination, and fear of deportation. And all of that is happening within a system that doesn't provide adequate support.
It's like a ripple effect, isn't it? And the socio-ecological model, it helps us see that we can't just focus on one level.
Right. We have to address all of these interconnected issues if we want to create real change. And that brings us to community engagement, which is so crucial.
Absolutely. We can't just impose solutions from the outside. We need to work with undocumented communities to understand their specific needs and develop culturally appropriate services.
And that means building partnerships with local clinics, community organizations, and grassroots groups that are already doing amazing work.
Why is that so important, this understanding of culture and values?
Because different cultures have different beliefs about mental health. What might be seen as a problem in one culture might be completely normal in another.
So we have to be sensitive to those differences if we want to provide effective care.
And we have to be respectful. We need to listen to the community and incorporate their perspectives into the services we offer. It's about true partnership, not just telling people what they need.
Okay, so let's wrap this up. We've talked about a lot today. Can you remind us of the key takeaways?
Sure, we've learned that undocumented immigrants face a lot of challenges when it comes to mental health. They're at higher risk for mental health problems, but they're less likely to seek help.
And that's due to a whole host of factors like lack of insurance, fear of deportation, stigma, language barriers, and just a general lack of culturally competent care.
Right. And we talked about the impact of legal status, the challenges that service providers face, and the need for more research.
And we also explored some frameworks that can help us address these issues, like empowerment theory, social exchange theory, and the socio-ecological model.
And, of course, the importance of community engagement, working with these communities, not for them.
As social workers and as human beings, we have an ethical obligation to advocate for equitable access to mental health care for everyone, regardless of their immigration status.
It's about recognizing the dignity and worth of every individual.
All right, so here's a final thought for our listeners. Think about everything we've discussed today, all the challenges, all the complexities. What is one thing, one shift in perspective or approach that you believe could make the biggest difference in the lives of undocumented immigrants and their mental well-being? What needs to change? Take some time to reflect on that. Thanks for joining us on The Deep Dive.